really pretty sunset.
Yeah, it is.
I don't know if that can show up or not. I think it's whitewashed. So how do you think RAELYNN'S doing?
I think she's doing good.
I think she's doing good
I think
too.
we're exhausted doing all the things,
Yeah.
but she's doing good with them. We keep doing all the things.
Yeah, we're doing lots of things.
I think about 20% of her day, 24/7, we're doing things.
Right.
Treatments.
Yeah. Has she needed oxygen today?
Nope.
No oxygen today. But she did need a little bit yesterday.
And normally, if she was off oxygen, we would definitely not be doing this stuff every 4 hours. We'd probably go back to twice a day and not even do albuterol at all. So we're really like overkill for her symptoms. But I'm good with staying on that
Right.
route.
Show off your t-shirt. You have a good t-shirt there. Let's show how RAELYNN'S doing.
Awesome, designed it.
Yep,
Huh?
Amber did. RAELYNN, how's it going?
Say hi to people. Say hi to your fans. Say, I'm doing good.
Yeah, she is.
I'm doing good.
Got a mean look on your
You've been
face.
smiling a lot lately. Oh, you got a hair in your mouth.
Oh, maybe that's why they had a mean look.
You give a smile? No.
It's a nice day outside. It's good to get some fresh air.
You smile, RAELYNN. Where's a smile? Where's a smile? Huh? Do you have any smiles? Just a little one.
Hey, nope.
Wiggle, wiggle, wiggle.
Do you have hiccups? Do you have the hiccups, RAELYNN? Yeah. Oh my goodness. Oh my goodness. Are you okay? Oh my goodness. Oh my goodness. Oh my goodness. How long are you gonna have the hiccups? So I actually have a surefire way of getting rid of my own hiccups. It works every time, but it's torture to go through, so I would certainly not put RAELYNN through that. But basically, I hold my breath, well actually, I take as deep of a breath as I possibly can, and hold it in my lungs for as long as I possibly can, and then breathe it all out, and having no air in my lungs, hold that as long as I possibly can, and then take a deep breath after that, and the hiccups are always gone after that. It works every time. It feels awful. And I obviously can't tell RAELYNN to do that, but she does get the hiccups pretty much every day around 2 o'clock, and right now it's 1:40, so right on schedule. Are you going to tell those hiccups to go away? Are you going to tell them to go away? Oh my goodness. You wearing her shirt? There it is. Yep. Yeah, Abby was wearing it yesterday. RAELYNN. You made to bring oxygen in or no?
What's she at?
91.
RAELYNN.
92.
Hey. You need some oxygen? You've done all the things.
Bring it.
Done all the things.
I'll bring oxygen in.
Are you happy? Her body's thinking about having a seizure.
Can you get the magnet?
I have it.
That oxygen's on now. Let's turn it on to a 4th.
You're just doing a 4th a liter? Are you seeing?
How are you guys doing?
All right, we're doing pretty good.
And she's having some hip pain, or was she having pain, or just there's some changes noted?
Yeah, no, she was having pain. She was overdue for her Botox. I thought maybe, that was it. Dr. Levin gives her Botox and ethanol injections, and he's like, what about this hip? And I'm like, yeah, we thought it was bothering her too, but we thought it was the, overdue for Botox. And he's like, let's get an x-ray.
And then you had spine surgery?
Yeah, she had spine surgery in November. And then they had to go in and do 2 more surgeries because she had an infection and clean it out. And then they just did a 4th one to put the bone graft back in.
So how are we doing now?
Well, her hip's been bothering her more, and some of that is, I think, because Botox was like overdue, so she's getting tight because of that. Some of it, I think, is in spine surgery, don't they have to like pull you straight? I think it may be just irritated and, you know, kind of sped up things that were already coming out of socket some. So it's her right hip, which used to be her good hip, that's hurting her. But her left hip, which is much more subluxed, or whatever your words are for it, it really doesn't bother her that much. And I was wondering, like, is this right hip gonna move its way out more so it won't bother her? Like, what should we do with it?
That's a very good question. We have the x-rays here.
Her range of motion was really bad then. Dr. Tomko prescribed her tizanidine because, so we're doing a Zoom appointment because she got COVID. We found out she had COVID, and so she couldn't get her Botox and ethanol procedure. And I'm like, if we have to wait another month, she's really hurting. He prescribed her 2 milligrams tizanidine, PRN. She is stretching her legs much better. She is not acting like she's in nearly as much pain. So that is helping. You know, what's her hip and what's tight hamstrings, I can't tell what hurts. I'm not good at judging. But the tizanidine is helping her quite a bit right now. You would like put make the socket different so that it wasn't able to slip out as easily. We went through 2 surgeries for her hips. Both of them had complications and required follow-up surgeries. She seems like very high risk for complications. Every time she has a major bone surgery, she has complications.
So the reason it probably bothers her now is before her spine was crooked, but it was somewhat flexible.
Okay.
That is now a stiff, necessarily so. Now that's a stiff thing, and she doesn't have the spine to compensate for the hip being a little bit stiff.
Okay.
So now there's more stress on the hip, and that's why it's bothering her.
So she has COVID, right?
Yes.
She's doing well. She looks really good there.
Yeah, she had no symptoms when she first got diagnosed. It was just because she had to get the test.
Yeah.
So she got some symptoms Friday night, and Saturday and Sunday she needed some oxygen. She didn't need any Monday. She just started needing some just now, but only a drizzle. So yeah, she's doing good. All right, thank you so much.
And then we can go and talk about surgery at that time.
Okay, thank you.
All right.
Take care. Okay. They want to do hip surgery.
Yeah. Did that sound reasonable?
He knew last time we were in, we were upset about having so many surgeries. So
Right.
he was just like, don't do it.
Right.
Don't do it. Come back if she's hurting worse. Because at the time she wasn't hurting that much either. He said, you have 2 options. You can keep doing Botox and ethanol and see if it keeps the pain away. And if it starts hurting down the road, we would just take part of the bone off and not put it back in socket. He said that's what we would do if you told me her right hip was bothering her. We would remove part of the bone. And my guess is he's going to check the right hip and tell us if he thinks, you know, it is bothering her a little. If I'm already going in, I should do this. Mm-hmm. He said, or her left hip. Her left hip that's worse. He's like, if that one's bothering her, we would take off part of the bone, salvage surgery. He's like, the right hip, he said, where this screw is from her spinal surgery is preventing her from compensating for this subluxed hip. And he's like, I can't even put it back in socket because of where this screw is. He would like just redo her hip and make a new something. He's like, I think that's what you should do. But he's like, if you don't want to do that, that's fine. He's like, you could just do Botox and ethanol. And if it keeps hurting her down the road, we would do what he's suggesting for the left. But he's like, you can save it. You should try to save it. That's what I think. But if you don't want to, that's fine. He's like, the spine surgery is making her hip worse because she can't bend.
Is he lowering her hips? He's lowering her hips.
On that side only?
I guess he knows what he's doing. He's good.
He's the expert, and honestly, I think if she needs a hip surgery, we should get it before he dies
Yeah.
or retires.
He's a great doctor, and he knows what he's doing. That sounds weird to me, lowering one side but not the other. But if he knows what he's doing,
Well, the other side is too far out of socket. It doesn't make sense to try to put it back in, they say. And
Okay.
he's like, if it's... I would like him to look at it, and I would like his opinion on is it hurting her or not, too.
yeah. So we're looking at having another surgery for Raylan. We don't know. I mean, we don't have it scheduled yet, but she's been having a lot of pain in her hips, and the surgery should relieve some of that pain. We're still on the fence. We still have more appointments with the doctor about it. It's possible we could just continue doing Botox and ethanol injections to kind of loosen up her muscles, but that's not a permanent solution. More permanent would be going through another surgery. Seems like there's always so many surgeries. And I just want to say too, the way we sometimes decide whether or not a surgery is good for Raelynn is thinking through whether it's going to improve the quality of her life. I mean, it's really a hard decision for kids like Raelynn. There's a lot to weigh, and one of our greatest priorities is just keeping her from having pain, especially right now. We don't want her to have pain in the present because we don't know what her lifespan is going to be. So if a surgery's goal is to keep her from having pain 10 years from now, that doesn't sound like a good surgery to have. But if the surgery is going to keep her from having pain in the next year or two, that's a much better surgery. So she's having pain in her hips now. The Botox and ethanol injections typically relieve some of that pain, but they're not perfect. They're not permanent, whereas a hip surgery would be more permanent. So that's a lot to weigh. So keep us in prayer. No matter what, though, no matter what happens, we still have hope. And I hope that you do too. God bless you guys.